things started happening that weren't like the regular chest pains that I was having. I was sweating, I had a little cough, I just didn't feel well. All I know is I woke up and I have breathing tubes down my throat. I'm pretty much on life support. January of 2020, began having chest pains that were out of the ordinary. The pains actually felt like acid reflux. And my dad has acid reflux, so I said, well, maybe it's hereditary. I visited my primary care physician, explained to him that I was having these chest pains and I'm not sure what they were coming from. I was ultimately referred to a cardiologist where I did a slew of tests. I did a stress test, I had MRIs and CTs of the heart, and they couldn't find anything wrong. Everything was coming back normal. I never in a million years thought that it would be anything serious. So when the doctor told me that it was possibly anxiety, being a single mother, working full time, going to school full time, I just went with it. I'm kind of relieved that it was anxiety, but they didn't stop just because they said nothing was wrong with my heart. I got tired of going to the doctor and explaining these concerns, and they just sent me home. Nothing was being done. So time goes on, and I'm working, I'm going to school, still being a parent, dealing with these chest pains every other day or every couple of days. And because they tell me it's nothing wrong with my heart, I'm not trying to worry about it so much. April of 2020, I went to sleep and everything was perfectly fine. I woke up 3:30 in the morning with the chest pains. Usually when I have the chest pains, I would take a Tylenol or aspirin and wait for it to start working and, go about my day. But, as I tried to lay down and go back to sleep, things started happening that weren't like the regular chest pains that I was having. I was sweating, I had a little cough, I just didn't feel well. And I just knew that I wouldn't be able to work and deal with this pain that day. So I called out of work, and my manager said, being that you work in healthcare, you can't return to work unless you go get tested for COVID. So I called my brother. He took me to be tested for COVID, and he said he looked in his back seat and realized that I had dropped my phone and I was kind of losing consciousness. And so he decided to take me to the emergency room, and I don't recall any of that. My brother called the emergency room to check on me to see, how I was doing because I hadn't been responding to his messages. The doctor got on the phone and told him that they needed a verbal consent to perform open heart surgery or I wouldn't make it through the night. All I know is I woke up in cardiac ICU and I have breathing tubes down my throat. I have machines everywhere. I'm pretty much on life support, and I have two nurses standing at my bedside. And one of the nurses say, this is a 30-year-old female. She suffered a massive heart attack. And I'm thinking to myself, laying in this bed, like, she can't be talking about me. Over time, my kidneys began to shut down and I'm started on dialysis. 30 years old and I'm on dialysis. It's unimaginable. It turns out that with everything that was going on, all of those things were signs of heart failure. Like I said, I was a single parent of two small children at the time. They were 5 and 9. I believe I cried every day. It's hard. I don't wish that on anyone. I had no family history of heart failure or heart disease, but, it started with me. After going to rehab and building my strength up and learning how to walk again and basically live life again, I had to go to cardiac rehab and strengthen my heart muscles back up, my legs and everything else. When it comes to your health or anything for that matter, always go with your gut. They say these are common signs and symptoms of heart attack or stroke. It's not always clear cut as they make it seem to be. You know your body better than anyone. If you know something is wrong or you feel something is wrong, keep pushing the issue until something is done. It could very well lead to something major.